Good morning. Today is Saturday, October 28th. This is our regular yoga therapy class. Let's do a little sound check. Check, 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 sound check. Okay, here we are. Let me check the sound. Okay, the sound check is perfect. And this is 9:29. This is our time. Okay. As you know, this is our regular Saturday morning yoga therapy class. And it used to be in person for years and years and years. Now this is in Facebook Live. And we started it after pandemic, and we are really doing classes for the requests. So the next request we came for, obviously, from cardiac disease to pulmonary diseases like asthma, COPD, pulmonary fibrosis. We have a lot of requests about yoga therapy for mental illness, psychiatric conditions, but answer is so simple, is that the whole yoga therapy works through your limbic system, amygdala hippocampus. That means it controls your mind. As you say, mind is a software, body is a hardware. So whole yoga therapy is geared for treatment of the mental illness and neuropsychiatric disorders. Sure, we will do your focused yoga therapy practices for different kind of neuropsychiatric disorders, like say we'll pick up say neurodegenerative disorders, Parkinson's disease, multiple sclerosis, peripheral neuropathy. We talk about neurotransmitter related disorders, okay, like those, dopamine, oxytocin, serotonin, endorphin. Okay, let's start with the basic physiology and pathology of pulmonary diseases, which is called a lung disease, and we'll give you the ideas. You know, the practice, most of you are a long-term yoga practitioners or yoga teachers, and many of them who have just joined, they have a tremendous interest about yoga therapy. So let's give you some ideas first before we do. Practice, you know, I have all of them in my YouTube videos. You'll be able to look at it. The first, the diseases we are talking about first is asthma. Asthma is a tightness of the bronchioles. So the respiratory channel starts with the nose, it goes into the side, it's called the turbinax, where it generates the vortex. It goes over the sinuses, mucous over sinuses, back of your throat, and there is a sphincter, you know, it separates the channel, the larynx behind and esophagus in front, pharynx in the front, pharynx and south esophagus. So it goes down the larynx, the vocal cord, then is, you know, the main trachea. Trachea divides into two, right and left, divides into bronchi, then like a branch of a tree, like a bronchioles, and it end up with the end called your alveoli. And on the alveoli, there is a surface of the oxygen on one side, and the other side is the blood vessels, which carry the impurities from your body, which is called your deoxygenated blood, and there is an exchange between the membrane, pulmonary alveoli. The blood picks up the oxygen, become oxygenated. It gives all of its end product of metabolism, which are primarily carbon dioxide, and your volatile substances, which comes out through exhalation. In asthma, what happens? The tightness of the bronchiole starts primarily from an inflammation. There could be one which is a primary bronchospasm. Many children develop it, but also children's underlying condition is the upper respiratory infection. So in yoga therapy, as we talk about, we always look at the source. What is the main root cause? We are not like Western trained physician. Oh, you have a high cholesterol, you have a high sugar, you have a high blood pressure. We go to the root cause. What caused your atherosclerosis? What caused your rupture of your plaque to cause an acute myocardial infarction or the heart attack? Same way, we are looking at what causes. Okay. So the inflammation of the upper respiration or allergies from the external source. Inflammation from the outside source means our immune system is not strong enough to fight that inflammation from outside. Low immunity. Allergies, on the other hand, is your high immune function. That means you have an allergen coming to your nose and body reacts. Body reacts with high immune function, with all these substances. It creates a cascade of phenomena called the allergies. This inflammation is going to trickle down, going to the bronchotrachea and the small bronchioles, and the inflammation there starts causing a spasm of the muscles, smooth muscles. This spasm also, people think, comes from primarily from genetics, from family history, but we all think it's all coming from the inflammation. Then it starts producing a secretion, like what we call your secretion coming out. And in the process, you can breathe in, but you cannot breathe out. In asthma, the problem is exhalation. So try everything, how to improve your exhalation. So inhalation is active. I can take a deep breath in, but exhalation is passive. Next step, what happens when the air cannot come out properly from the alveoli? The alveoli is like a small sac or pocket. And there's a separation called septa. The separation starts to break, and this alveoli starts to collect and form a big, called a balloon, or called a bleb. From a balloon or a bleb, we call this step is called emphysema. In emphysema, what happens? Now the body has a bleb in the lung, which it cannot remove all the carbon dioxide and the end product of your metabolism or breathing, the volatile substances. The body builds up more carbon dioxide. So we call it a CO2 narcosis. Carbon dioxide causes a sensation of narcosis when it acts like a narcotic. So the body has a response called chemoreceptors, like a blood vessel response with a mechanism called the baroreceptors. In an asana practice, baroreceptor sensitivity goes down, and here the chemoreceptor sensitivity goes up. So body can start like dealing with CO2, and there is a lot of cascade of phenomena that takes place through the kidneys and how the body reacts to your emphysema, and then it becomes called a COPD, chronic obstructive pulmonary disease. COPD is a hypoxia and a hypercapnia. That means low oxygen and a high carbon dioxide. So asthma, emphysema, COPD, then comes your another one, pulmonary fibrosis. A lot of cause, we call it idiopathic fibrosis, but underlying cause is the inflammation. The inflammation of the lung, the alveoli, what happens, body responds to inflammation with its fibroblast. Fibroblast means basically it's a scar tissue. Like if you have a cut in your hand, the cut will heal up with a scar tissue. That is called fibroblast. The fibroblast starts depositing and the lung membrane cannot exchange the oxygen and carbon dioxide. And there is a sense of hypoxia and hypercapnia. Pulmonary fibrosis sometimes is very almost like a malignant. I've seen two anesthesiologists. They went to overseas trip. They came back. It looks like I have symptoms like a flu, severe flu. Within a couple of months, they develop a pulmonary fibrosis. So we'll talk about all the therapy on that. So now you understand the root cause is the inflammation in the nose. And you see the kids, go to school, go to daycare, both the nose are running, the mucus is coming, and started living with it. Go to the doctors, what do? They give you some local antihistamine or local steroid. Big thing, Flonase, Flonase is a big thing. All the kids getting Flonase, steroid in the nose. Oh my God. Antibiotics. So the first line of therapy, yoga therapy for pulmonary disease, is a JAL-NETI. Neti-Pot. Washing your nostril. First thing in the morning, every single day. This is part of our daily routine called Dinacharya. I don't know how long I've been doing it. I have not missed a single day. Fill it up. In the morning first, you sit down, you drink 2 glasses of water, which is called your Ushapan. And when you sit down in a malasana called squatting pose, after a while you get a sensation of a bowel movement. And you have a very good bowel movement in the morning. And basically you're healthy. When you drink 2 glasses of waters and you have a bowel movement in the morning, that is a sign of your health. On the other hand, if you have a meal or a big meal and then go to the bowel movement, that is your irritable bowel syndrome, IBS. Your distinct thing. Brush your teeth, scrape your tongue. Scraping of the tongue is one of the therapy for chronic obstructive pulmonary disease or any pulmonary disease. JAL-NETI. Fill it up with a lukewarm water, use some salt, non-iodized salt, and you have seen me doing it, and you can go to my website, YouTube, put through one nostril, close your eyes, open your mouth, turn your face on the other side. When you're properly relaxed, a whole stream of water will come down to the other side. Blow your nostril, both the nostril, fill it up again, do it from the other side. Same way, close your eyes, open your mouth, breathe through in and out through your mouth. Turn your head slowly on the left side and the whole water will come out. Initially it may not come out because it may be very tight, but essentially it will come out. We do not recommend this for when you have a cold, when you have an allergy and everything. This is the part of your daily life. Brush your teeth, clean your nose. Remember, this is where your life is going. You wash your face, wash your eyes, wash your hair. You put all the hairs down beautifully. my God, this is your life prana, the life force coming through your nose. And you don't want to keep it clean. And then when you do it, you will see when you blow out. And if you're in the, in other countries, polluted countries, polluted city, Mexico City, or maybe in New Delhi, in India, or in Calcutta, you will see when you do that, basically the carbon particles comes out. And with this time also, the pollen, you'll see all the, oh, I have a pollen allergy, I'm doing the, no, you continue every single day. When you're traveling, here it is. When I'm traveling, I'm using a plastic one. I don't recommend a plastic one for daily, but I'm traveling, I keep one in my toiletry. This is my body part when I'm traveling. And then what I do, I put the non-oil salt in it. This is called your TSA approved container. Very, very important. If you take a white particle, something white with you, TSA is going to throw it away. It doesn't look kosher, you know. What does it look like? They would think it's some kind of a drug, the white powder, and so you carry it in a TSA approved container. If they want, they can check it, test it, and put it back again. So TSA approved lock, TSA approved containers are very safe for traveling because you're not going to lose anything. In India, when I was traveling, they had very, very creative, and in yoga, copper is being used because copper cups, drink water from the copper. They also have a copper Neti-Pot. I've been tried, it's very interesting. The copper Neti-Pot is the same thing, using Neti-Pot with using a copper. It's wonderful. We also do call a Sutra Neti. Sutra Neti, we put a small red rubber catheter to the one nostril. It comes out to the other nostril. We generally use about a 12 French catheter. This is your 12 French catheter. We use through one nostril. It comes through to the other nostril. It acts like your, let's see, I may have one open one somewhere. Yeah. So it comes out like, initially you won't be able to do it, but once you keep on doing it, we take it, lubricate a little bit, put it through one nostril, and people get really, oh, wow, it looks like it should generally goes very nicely through inside. I'm not going to show it to you because we do it in private, and then slowly when it comes out, it will come out through your mouth because they're connected. And then, in the mouth to the nose, we do the flossing of your nostril. Sutra Neti. Money back guarantee. Sorry. Now, we do every morning the JAL-NETI. Sutra Neti also I do quite often. So throughout the whole day, we get a little bit of drainage, a little sneezing, drainage from a nostril, entirely normal, because nostrils are open. Then we follow all of our daily routine. I had so many children who started doing this, and they are now grown-up adults, and they're still continuing it. I was on an overseas trip. I had a little kid who was about, 14 or 15 years, and he's been suffering. He's suffering through whole, this upper respiratory infection. And then once he started getting into this, he feels so better, literally he hooked to it. So here he comes to me, he said, do you have any non-iodized salt with you? I ran out of my salt. I want to do this. A lot of question comes up, the water, which water do you use? Our recommendation is, if the water is drinkable, you can use it as JAL-NETI. I have no problem using the water from the tap in United States. You have a little lukewarm. If you're a little more concerned, you can boil the water, or you can use a bottled water, a sterile water, up to you. Overseas, when I'm traveling, I generally do with a bottled water because they're drinkable. Once it's drinkable water, I do that. So this is the first line of therapy. Next, when you have this effort in breathing, body uses called the accessory muscles of respiration. They do like this. You know, you'll see people with asthma, COPD, how do they breathe, you know? I mean, it's amazing that what the condition of living. They put the inhaler, they put the steroid, they put the pump. It's a miserable life. Biggest fear in your life. Probably all of you. Anybody know the biggest fear in your life? You can give me an answer. I'm looking at your answer. Biggest fear in your life. I'm waiting. Count of 1, count of 2, count of 3, count of 10. Biggest fear of your life is not able to breathe. And yoga, heart and lung is the same organ. If you put an effort in lung, you get an effort in your heart. You get an effort in the heart, you get an effort in the lung. So like when you do the asana practices, when you get an effort, like when you have a pain, when you have a effort, you know, in your asana practice, you shows up in your breath. So all the asana practice will be effortless breathing. So the first concept is now you have tightness of the neck, tightness of the chest, tightness of the upper muscles. Relaxation of the respiratory muscles. Respiratory muscles are called skeletal muscles. They're trainable. So the chest opening pose many a time with a Bhastrika, bellows pranayama. Like you do inhalation, you know, here, you inhale and then exhale. This is called bellows, Bhastrika pranayama. But before that, you prepare your body with asana. Like for example, hand relaxation starts with your Adhi Mudra or Bala Mushti Mudra. Put the thumb inside and close. Now, any pathology in the hand is going to take care of them. I had a serious trigger finger. This was my trigger finger, 2 trigger fingers. I have been doing this, my Adhi Mudra, trigger finger. It took some time. Remember, yoga therapy is a very effective medicine, but it's a very absolutely slow medicine. Wrist gets relaxed with extension. So breathe out first, inhale and exhale. Inhale, exhale. What is good for your pulmonary function or the pulmonary underlying condition is a hand strength asanas. So every hand strength asana, like you can do a downward facing dog, Adho Mukha Svanasana. Then you you get some wrist pain. People come and say, I have some wrist pain, I cannot do a hand, you know, hand pressure, hand strength asanas. Don't do it. Prepare your wrist first. See, pain comes from the tightness. People all talk about pain. It's from arthritis, this for my damage is gone, my cartilage is gone, bone, everything is gone. Who cares? Pain fibers are only in your ligaments and the muscles. Tightness of the muscles, tightness of the ligaments is the root cause of the pain. So the moment you relax, pain goes away. Relaxation of the wrist. So hand strength, like your, say, done means push-ups, tulasana, raising your body high up, pakasana, crane, mayurasana, peacock, mayuriyasana. Those are all hand strength. More you have a hand strength, better is your pulmonary function. Shoulder get relaxed with your shoulder relaxation. You can put your hand in the shoulder, put elbows together. Always do your breathe, closing your eyes and be sure there is no pain, there is no effort in breathing. Breathe out first. Take a deep breath in. And slowly rotate your shoulder. Breathe in, breathe out. Breathing out longer than breathing in. Breathe in, breathe out. You can do opposite side. Always do the balancing. You can hold your wrist high up. Breathe out first, breathe in, pull it all the way down behind your head. Again, breathe in, breathe out, and the same breathing out cycle come in the top. Breathe in, breathe out. Breathe in, this very easy relaxation you will be able to do, but if you think that these people have a pulmonary problem and you can treat them with pranayama. Voluntary control of your breathing. They cannot do pranayama. The reason is they are so fearful about breathing. So these are koshas, annamaya kosha, physical body. Physical body, I'm having a constriction of the bronchioles. It causes imbalance in the pranamaya kosha. Pranamaya kosha means breathing. My breath is now imbalanced. With my breath, I cannot breathe properly. What happens? I become anxious. I become restless. It's my mind, called manomaya kosha. My mind is in imbalance now. When manomaya kosha is in imbalance, then it causes imbalance of your viganomaya kosha, which is your intellect, your judgment. Your judgment goes away. You don't know what to do. You don't know how to breathe. You don't know what oxygen you have to look for. And have an imbalance in your viganomaya kosha, the imbalance in anandamaya kosha, or a blissful state. On the other hand, when your anandamaya kosha is in balance, in a blissful state, your viganomaya kosha is in balance, manomaya kosha in balance. So many times we start with them with a little bit of controlling the mind. Maybe a little focus meditation. Or focus your breathing. We do the chest opening poses. And you have a lot of chest opening poses. You have a, say, cobra pose, bhujangasana. You can do a fish pose, but best chest opening pose is the prayer pose to the back, Paschim Namaskar. And you have seen me doing it, many, many times. I do it simply sitting in this setup. You can see me, yes. So you'll put your hands together. If you cannot come here, wherever you come, stay here. Close your eyes. Do breathing out longer than breathing in. Slowly put your hands together and put a prayer pose, and slowly put a prayer pose. Neuroplasticity will set in, which is basically what we call your habit. Hand will still go high up, and you'll come to the state that you're able to, this is your normal posture. For me, I can sit down in posture for hours and hours, because this is my normal posture. That is called your sthiram, sukham, asana. Stillness, happiness in an asana practice. Mind in yoga is described as the content of your five senses. We hear, we see, we smell, we taste, and we touch. If we put all the contents together, that is your mind. And when these contents become properly processed, that becomes your intellect, your buddhi. And your intellect be properly processed, that becomes your wisdom. So wisdom is your actually Anandamaya Kosha. In Ayurveda, if you look at Ayurveda, it's called a tridoshi. Vata constriction, or bronchial constriction, is a Vata imbalance. Inflammation of the bronchiole is a Pitta imbalance, and a secretion in the bronchiole is a Kapha imbalance. So it affects you both Vata, Pitta, and Kapha. So the mind quiets down, like say for a few practices, is that you can do like sit down with your spine straight. You see, I'm sitting, and you have seen all this. All of you have seen me. This is your kneeling stool. I sit down in kneeling stool. My spine is always straight. I can sit on a chair. Still, my spine will be straight. Merudanda Chal. Manasthir, quieting down your mind. Haruddu, quieting down your mind. Hand is the connector in the body and mind, hand mudra. You touch your index finger and thumb, this is called a Dhyana mudra or a Jnana mudra. Put it on the top of your knee. Pay attention to your breath first. Lung is like a balloon. It has a 6-liter capacity, and we need only 1.5 liter to keep the lung open. If a 4.5 liter can be exchanged, that's called your vital capacity. And normally we breathe in and out, but a tidal volume is only half a liter, 500 cc. We have a 3 liter called inspiratory reserve. That means we can bring in 3 liters of oxygen in one breath. 1.5 liter is an expiratory reserve that you can remove 1.5 liter. So for the lung to have a proper breathing, first you do, after a Neti-Pot, JAL-NETI, to be sure your nostrils are open. Most of the time you'll see your one nostril is more open than the other. And it's a cycle, it goes on, called alternate nostril breathing. And now you're seeing the right nostril is more open than the left. After a while, generally it lasts about 90 minutes or a little longer, the other one opens up. So you can close your one nostril. I'm closing my right nostril. I'm breathing in and out through my left nostril. There's nothing called a deep breathing. You make the breathing little longer and longer without any effort. Essentially, it becomes deep by itself. Plug the other nostril, now breathe through the right nostril in and out. Both the nostril is almost equally well thanks to Neti-Pot and JAL-NETI. It's wonderful therapy for your pulmonary diseases. Exhalation is parasympathetic, inhalation is sympathetic. So when you're going to breathe in, your heart is in stress, which is a parasympathetic overdrive. You need to create parasympathetic activation. So you breathe out first. Slowly breathe in, longer and longer. Breathe out longer than breathing in. If you keep on doing it, you'll see this is a voluntary muscles. You'll be able to train and you will be able to do longer and longer inhalation and exhalation without any effort. We are doing it for a long time. Let me show you. I'll do it silently. I'll breathe out first. I'll breathe in with a count of 8 in. 8 seconds in, 16 seconds out. And whenever effortless breathing, I will be able to talk, I'll be able to sing. Breathe out first. Beautiful. 8 seconds in, 16 seconds out. Think about it. So 24 seconds a cycle. What becomes? So almost two and a half breaths per minute. So reduction of the number of breaths per minute is the most effective therapy for pulmonary condition. You can do a focus meditation controlling your 5 senses. Then you can do a Bhramri pranayama, bumblebee breathing. Then you can do your neck relaxation called Brahma Mudra with Bhramri pranayama. These are all the practices we do for a daily practice, but this is called a pick and choose for a pulmonary disease. Focus meditation controlling your 5 senses. Dhyana Mudra or meditation mudra, your knees, spine straight, eyes closed. Breathe in and out effortlessly. Exhalation longer than inhalation. Visualize 5 objects around you. Bring your attention to those 5 objects. Pick up 4 objects out of 5. Try to listen the sound of those 4 objects. every inanimate and animate substance with sound with them. Pick up 3 items out of those 5 and smell their fragrance. Beautiful fragrance of those 3 items. Visualize 2 items and taste those 2 items. Visualize 1 item and touch that item. Hold that item. Keep your hand on that item. This focused meditation, controlling 5 senses, you will see your breathing will get better and better. Controlling your mind, controlling your manomaya kosha, balances your pranamaya kosha. From there, you can do your Brahmari pranayam, bumblebee breathing. Shut down your 5 senses. Then you create a vibration. Vibration, you're breathing out like a bumblebee. Brain has a vibration, 2 vibration cancels, interacts, called harmonic resonance. Mind quiets down, breathing improves. Index finger in your forehead. You can do Shanmukhi Mudra, or you can use 3 fingers to close your eyes, put your thumb to close your ear and close your mouth. Breathe out first. Take a deep breath in. Breathe out with the sound of a bumblebee. Slowly do pumming and cupping. Rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Use the hand like a cup, put it over your eyes. Eye is supplied by over 4 cranial nerves. Retina is supplied by the optic nerve. SO4, LR6. Superior oblique muscle supplied by 4th cranial nerve. Lateral rectus muscle supplied by 6th cranial nerve. Outside is supplied by trigeminal nerve, and also facial nerves comes in there. So it is a huge collection of your cranial nerves getting quieting down. Ciliary muscles get relaxed. Your lens becomes more convex. Massage your forehead, massage your eyes, massage your face. All the muscles are here and attached to your skin. So the muscles are relaxed. All the line goes away. All the frowning goes away. Skin looks like you're glowing. Massage the earlobe, behind your ear, in front of your ear, go in fact inside your external ear canal. There's a branch called auricular branch of vagus nerve. It is a vagal activation. Take your hand, massage in the side of your neck. This is your carotid sinuses. When your carotid sinus is supplied by glossopharyngeal nerve, the heading, the Brewer branch quiets down your cardiovascular system and nervous system. Takes the hand, massage the occipital tubercle, where the sternomastoid and accessory muscle is attached, which is supplied by cranial nerve. Your breathing becomes better. Then you do your Paschim Namaskar, then relaxation of the neck with your Brahmari Pranayama. Now your hands to the back, like a Paschim Namaskar. You breathe out first. Deep breath in and put your neck to the back. When you get a little cough during pranayama practice, it is entirely normal. What happens when the air is going to the right channel? Right channel means going over your larynx, over a vocal cord, where all the cough starts. So don't get any surprise when you get a coughing during your pranayama practice. In fact, it is a better sign that air is all going through your larynx and trachea instead of your pharynx and esophagus. Breathe out with the sound of a bumblebee. Same phenomena, neck on both sides, with the same Brahmari, bumblebee sound on exhalation. Breathe out first. Look all the way to the back without turning your shoulder. Rotate your neck to the left, to the back, to the right. then right to the back to the left. People with a pulmonary problem, now you're ready for your pranayama practice. Pranayama, you're doing sequentially. Daily practice, what we do is good for all pulmonary diseases. Start with the Bastrika bellows, which is a gateway of pranayama, active inhalation, active exhalation. Kapalbhati pranayama, the breath of fire, Kapalbhati. Kapal is the forehead, Bhati is the shining. It's an active exhalation, no inhalation. Very good for emphysema, very good for COPD, but very slow Kapalbhati pranayama because you need exhalation. So all air is coming out. Alternate nostril breathing, Anulom Vilom pranayama, balancing both sides of the brain. Then you get into breath holding in inhalation and breath holding in exhalation. People tell me so many times, don't do that. It's going to hurt you. It's going to kill you. It's going to hurt your heart. You do every pranayama, therapeutic pranayama, as if it is your normal breathing. You will hold the breath as long as your breath is effortless. It could be 2 seconds. It could be 5 seconds, 10 seconds. For us, it is 40 seconds, 45 seconds. Inhalation, exhalation, 20, 25 seconds. But if you're very good in asana practice, the hand strength asanas, maybe you had a little time. Pranayama practice, you all have the pranayama on my YouTube, in my YouTube channel. So you'll be able to see all of them. I'll just guide you. What is that? So, hand, come a little bit in front here. Hand strength. So hand strength will first start with your downward facing dog, Adho Mukha Svanasana. From there you get a push-ups. The regular push-ups, Sadharandan. A lot of push-ups, Ram Murti Dan. You go to the push-ups and come back the same way. Misradan. You do the push-ups and then you come back to the front. Then go back in the front to the push-ups. Hand strength. Very important for your people with your pulmonary disease. Pulasana. So you can sit down slowly and comfortably in a Padmasana. In a Padmasana, raise your body high up with the Tulasana. Tulasana basically lifting. Hands on both sides. With your hand, your body goes high up. Your highs up and stays high up. We'll keep them up for a long, long time, as long as you can. But for the sake of time, I'm just showing you how to do it. What other hand strength asanas we have? Bakasana, crane, Moirasana, Moiriasana. So in a Bakasana, put your hand side, put your body high up, and slowly your body will go high up and stay high up. Bakasana. We stay as long as we can. And you see, I'm talking, I'm breathing. Very, very important. Moirasana. Remember, wrist. If you get a wrist pain, do not do it. Wrist has to relax, so there will be no pain in your wrist when you're doing this asanas. Put your body on your elbows, push your body in the front. We have to do it early in the morning. This is the early morning asanas, but you understood. Hand strength is the therapy for pulmonary diseases. So, pranayama, as you know, obviously therapy. For asthma, you have to learn how to do exhalation longer than inhalation. And for all practical purposes, for all pulmonary condition, Bhastrika bellow is the most important pranayama. One of my friends gave it to me because all of you are the city dwellers. You have never seen a bellows. This is bellows. Inhalation, exhalation. So use it for your, maybe your fireplace. Blacksmith uses it. Nasal drainage after JAL-NETI is quite common. You can do hand raised high up. Generally what we do, we do 20 a slow, 20 medium, 20 fast. That is one cycle, and you continue to repeat the cycles. We do 3 cycles, 4 cycles. So for the sake of time, let me just show you count of 10. First one is like we call it a Ishwar. And when you come down with your Adhimudra. Second one is called a Soham, Soham. Last one is called a Vishnu, Vishnu, Vishnu. So 10 in each, slow, Ishwar. Medium. So hum. Rapid. Vishnu, Vishnu. It's very effortless. Continue for a long, long time. Very good for all pulmonary conditions. This is the beginning or gateway of your pranayama. You can also do it just sitting down, raising your shoulder like this. I did 100 of them. Generally, for daily practice, I do more than 500, 600, maybe thousands. Kapalbhati pranayama, when it's done very slowly, it's a pranayama. When it's done very actively, it is a kriya. So you do the different mudras, dhana mudra, gana mudra, vayu mudra, shunya mudra, prithvi mudra, varun mudra, shakti mudra, pachan mudra, pachan vayu mudra. This is the end of mudras, huh? Then you get your Vishnu mudra, Vana mudra, Linga mudra, Ganesh mudra. So all mudras, but just Dhana mudra, Gana mudra. Right? Take your awareness to belly button, push it back. You're doing only active exhalation, no inhalation. Inhalation is in between without knowing it. You don't have to teach anybody inhalation. You have to teach exhalation. So this slow exhalation, it massages all the intra-abdominal organs. It hits the diaphragm. It massages the lung, massages the heart, and brings all the air out very slowly. Like here, if I put my hand in the belly button, push it in, air will come out. So when you do it, you would do it as long as you can without any effort, and then keep on increasing. How long increase? With each mudra, we practice about 50 of them. So the 10 mudras generally do about 500. Kapalbhati pranayama. Very good for removing all the trapped air inside the bleb. Remember, if you don't take care of the blebs can rupture. Blebs can rupture because they call it pneumothorax, air outside the lung. Activation of parasympathetic tone also starts with your breath holding. So the simple breath holding is, you breathe out first, take a deep breath in and hold your breath. It's called Abhantarin Kumbha, breath holding in inhalation. And then you incorporate the chin lock, putting the chin down, and it's called your Murcha pranayama. Murcha means unconscious. It is so powerful pranayama, it feels like you're almost unconscious. So let me show you one time. and call it inhalation, retention, exhalation, suspension. Breathe out first. Deep breath in. Hold your breath with a chin lock. Powerful tool for your pulmonary conditions. Breath holding and exhalation. You can do very slowly, which is called Savitri pranayama. 1:2:2:1. But here, you're doing called your Uddiyani Bandh. So, and all the bandhas also does all do the same thing, but for pulmonary, you do alternate nostril breathing with the breath holding called Nadi Shuddhi pranayama. Improving your lung function, breath holding in inhalation and resistive inhalation, called your Ujjayi pranayam. Ujjayi pranayam with a chin lock and left nostril breathing. Left nostril breathing is your cooling, calming, parasympathetic. And breath hold and forceful expiration is your Shankha pranayam. Let's finish with your breath holding and exhalation first. It is called your Uddiyani Bandh. Hand in Adhi Mudra. Breathe out first. Deep breath in. Completely breathe out, suck your stomach and hold. Do one, remember your chanting pranayamas like Om Pranayam, Pranabhu Pranayam, all Plavani Pranayam, Sitali, Sitkari Pranayam. In fact, what we'll do another session on the pranayama for pulmonary diseases. So as you understand the asana concept, we'll do the pulmonary concept, we'll do the practices. Maybe next time we'll do it. But let's do first, it's called a Shankha pranayama. Shankha is blowing a conch shell, but if you're in conch shell, you put your hand like called an Adhi Mudra, put one on the top. Generally, we don't breathe through your mouth, but for the pranayama practice we do, you breathe out first. Take a deep breath in through your mouth, close your mouth, breathe out through your nose. This is resistive exhalation. We're trying to exhale against resistance to build up the lung function. Resistive inhalation is a Ujjayi pranayama. Same way, you slowly constrict the larynx, try to breathe in like this. We'll go ahead and put a lot more details, pranayama practice for the next week for pulmonary diseases, because we prepare our body with the physical asanas. So let's finish Ujjayi pranayama with a Jalandhar Bandha chin lock, left nostril breathing. Breathe out first. Can't have a better practice than this. With the Ujjayi pranayama, with the Jalandhar Bandha chin lock, with a Chandravedi pranayama, left nostril breathing. Okay, let's finish it today. So we'll come back in the next week. Most likely next week I'll be in town, so I'll put a detailed pranayama practice for your pulmonary diseases. We'll go over the little guide for the asanas, then come to the pranayamas. Thank you. Thank you for joining today. And if you have any comments, questions, please put it in the Facebook. I do come and see every now and then, and I'll be glad to answer for you. Okay, see you soon, next Saturday.